This is a second briefing in a series of 3, recapping the Think Summit series on access to care, presented by Petal Health. This briefing focuses on the Ontario Summit and provides high-level overviews, but you can get the details and the briefings and everything that came out of the Ontario event at thinksummit.ca, artifacts YYZ. This specific event involved dozens of leaders from all across Ontario Health volunteering their time to collaborate together to try to find fresh ideas for how to actually narrow the divide between treatment demand and care capacity. The discussion threads covered a wide range of topics. Nothing was off limits, and a number of foundational principles emerged and key insights that everyone could rally around. But overall, what you got a sense of was a real bias to action. Things we need to start doing, like changing the narrative on data privacy risk, adopting federal standards that the provinces could enable, mandating the base data and information for systems-based decisions, and so on. Highly charged, very actionable ideas. And some of these things carried a lot of emotion. This idea of our overprotection of health data hurting our ability to deliver care was a supercharged discussion, and someone literally said, this has become a health risk. And I was in the front of the room, and I can tell you a lot of heads nodded when that was said. There are a number of things we should be doing less of as well. Less focusing on building every piece of technology over and over again and replicating it, not just in every province, but in many regions within provinces. Doing a lot more to be pro-Canadian in our procurement. But the punchline, if you had to distill the whole day down to one thing, came down to the need to be able to see what was going on. The need to mandate access to whatever foundational data was required to measurably improve access to care. That's a very high-level view to some very detailed conversations, and I would encourage you to go to the site and get the briefings and the actual artifacts. But before we sign off, I want to thank everybody who attended for the absolute candor, not just for volunteering your time, but for coming and sharing your passion and ideas on how to solve this challenge. And for everybody agreeing, including Petal Health, to make all of the briefings and the artifacts available under Creative Commons so that they're available to anybody who wants to help solve the access to care challenge. A reminder, we'll follow this with a recap on the BC event as well, but the briefing 1 is the whole overview. Briefing 3 will be the BC event, and we'll do a 4th one on our healthcare thesis and how the learnings from the Think Summit series impacted our thinking. That's it. Thank you for your time. Have a wonderful day.